Hi, I'm Dr. Mark King from the Motion Palpation Institute. We have a class coming up in Chicago, actually at National University, called The Disc. And we'll have Dr. Tom Lotus, Dr. Brett Winchester, and myself teaching. Lots of hands-on, but I wanted to give you just a few things to think about because knowledge is power. So why this conservative care idea that we obviously are very very much pushing all the time is so valuable in the community, especially when it comes to these things like disc injuries. So we know that if someone's injured and off work for an extended period of time, the longer they're off, the more likely they will never go back to work. So it's 6 months of off work due to lumbar injury, it's 50-50 that they're ever going back. If they're off a year, it's only a 25% chance that they're going to go back to work at all. Dr. Sean Thistle, he does that research review he's out of Canada. He talked about how MRIs are increasing, spinal fusions are increasing, opioids are increasing, epidurals are increasing, yet low back pain is getting worse. So again, this points to conservative care. So we need to be first line of defense for these disc patients, whether it's cervical disc or lumbar disc. In 2023, the Lancet came out with an article about opioids. Basically, long term, especially, they're not helpful with these chronic back pain and neck pain patients, often disc patients. Opioids are not the long-term answer. Many of you are familiar with the study that was done in 2012 out of Washington State with their work comp injury patients. If they went to a chiropractor first versus going to a spine surgeon first, the chances of surgery were dramatically different. If they went to a spine surgeon first, it was 42.7% chance they would have surgery. If they went to a chiropractor first, same diagnosis, 1.5% chance they were going to have surgery. So they need to start with us. There was an incredible paper written by Faribault et al. About the cost savings and hospitalization savings and so on if people were seeing chiropractic care for low back pain. So cost was less with the chiropractors, opioids were less with the chiropractor, epidural injections were less with the chiropractors, hospitalizations were less, surgeries were less, imaging costs were less, all less cost to society if they started with chiropractors. So one of the studies I mentioned a lot is Hooten et al. In 2022, American Academy of Pain Medicine. They talked about epidurals. It actually doubles the risk of a post-surgery infection. So they're not innocuous. A lot of times people say, oh, that's just conservative care, do an epidural. And sometimes the patient needs it. They need some relief. They need some way to break that cycle. I get it. I'm just saying it's not without risk. So that's important. That's an important point. In 2010 in JMPT, they talked about with disc herniations, if they failed medical management, they should consider manipulation after failed medical management, then manipulation, then surgery. Of course, I think we should do manipulation first and all our other tools, rehab, N-rings loading, and so on, before we consider anything. But this was the article, and that's the quote on that. So it goes on and on and on like that. There's lots of articles that support what we do conservatively. So like I said, knowledge is power. Come to Chicago, June 6th and 7th. We're going to focus in on the disc. It'll be at National. So we hope to see you there for that MPI disc class. Thank you for listening.